that she was too weak to write, but she wanted to write goodbye letters to her family of 25 people or so.
A sobering look inside our region hospitals and what those on the front lines are experiencing with this pandemic.
At Kootenai Health, an ICU nurse is sharing what her experience has been like after battling this virus for now more than a year. Good evening and thank you for joining us for KREM 2 News at 6 tonight. I'm Mark Hanrahan.
And I'm Tom Sherry. Whitney is off this evening, while hospitals in North Idaho are still operating under crisis standards of care. Kootenai Health in Coeur d'Alene is still treating more than 100 COVID-19 patients as of today.
Hospital leaders held a press conference earlier today to give an update on what the situation is like inside the hospital. KREM 2's Ian Smay explains how they're handling the current surge.
Kootenai Health was treating 108 COVID-19 patients as of earlier today, and of those patients, 33 were in critical care and 14 were on ventilators. Nurses at Kootenai Health have been constantly caring for these patients, and earlier today, one of them shared their experiences inside those rooms. Kootenai Health is still in the midst of its worst COVID-19 surge yet, and those on the front line say the people they are treating for COVID didn't think it could happen to them.
If they're able to talk, if they're not on a ventilator, a lot of them say, I didn't think that it would be me who's sitting in this bed. I thought it was either all political or all a hoax or just people who are in poor health or maybe don't take care of themselves as well who are getting this sick.
Since August 25th, Kootenai Health says 87% of its COVID patients haven't been fully vaccinated. Most had not had a single shot of the vaccine. Leaders say they are seeing 10 to 15 new COVID-19 patients a day. Treating these patients has been tough on nurses as they try to provide comfort for people dying, going as far as writing down a patient's final goodbyes.
One of my coworkers transcribed 25 letters to different family members and loved ones with her goodbyes and whatever notes she wanted to add, and that's, I guess, one example of something it's really hard for us to take on emotionally.
The strain isn't just on the healthcare workers caring for these patients. Resources are running thin. 9 beds are being used in an overflow space normally set aside for classrooms and conference space. Patients are being treated in other non-traditional areas around the hospital. One other worry for Kootenai Health leaders is a lack of space to care for children.
What we're thinking is that we probably could do somewhere between like 8 to 12 at this point in time. But if we get a really significant pediatric surge, it probably won't be sufficient. So we are looking at other ways that we might be able to expand that further if needed.
That comes as Kootenai Health Chief of Staff Dr. Robert Scoggins said they don't think they've seen the effects of the North Idaho State Fair or the start of the new school year. This has led to concern about providing care in the case of a surge in cases among children, paired with a lack of pediatric resources in the region.
Our big concern is that that the regional pediatric ICU capability could be overwhelmed, and we'll have to take care of them here.
One bright spot for Kootenai Health in recent days has been the use of monoclonal antibody treatments. Dr. Scoggins said they've kept some people out of hospital beds by using it in outpatient areas and in patients in the ER. He also said that they have been sending people home with oxygen supplies to keep some hospital beds free. Reporting in Coeur d'Alene, Ian Smay, KREM 2 News.
All right, so how do our hospitals here in Spokane County compare? At a press conference today, Providence Chief Medical Officer made it clear our region's hospital are the closest they've ever been to a breaking point.
We're dealing with an emergency that just keeps getting worse and worse and worse, and we're not sure where it's going to end.
A day after Providence announced it will stop all non-emergency procedures, Chief Medical Officer Dr. Dan Getz was clear our hospitals have never been this stressed.
We're at the highest level of admissions since the beginning of the pandemic, and we're closest to the breaking point that we've ever been.
He said there are 18 patients in the ICU on ventilators. Not a single one is vaccinated. A frustrating fact for physicians because none of those patients statistically would have been in the ICU if they were vaccinated, and a dangerous reality for those patients.
When you're unvaccinated and you get put on a ventilator for COVID, the odds of you getting off of that and living, it's roughly 60% chance of dying. It's like a flip of a coin, basically. Are you going to live or going to die?
Given the current situation, Dr. Getz says he simply can't believe our local leaders are allowing the Spokane Interstate Fair to take place right now.
I'm incredibly concerned that we have a big fair going on in Spokane. That makes zero sense in the middle of a pandemic, and we're hearing reports that we're lucky if a quarter of those patients are wearing masks. And so what it tells me is the community doesn't understand the level of crisis that we're dealing with. They don't understand the incredibly difficult decisions that we're making and delaying care in people that have cancers that we should be reviewing now because we need to make space for them in our hospital in case they get sick.
And for those who say getting vaccinated is a personal choice, he says they're wrong.
And I hear the argument over and over again that it's a personal decision, but I'll tell you it's not a personal decision, because if you require hospitalization and care, it's taking care away from that patient with cancer that's waiting to get that removed. It's taking care away from that patient that he needs their hip or their knee replaced. This impacts us all. It's a population health issue.
We also had a chance to talk today with Spokane County's interim health officer, Dr. Frank Velasquez. He told us cases are significantly up in children right now. Kids make up about 1 in 4 new COVID infections. And since kids just went back to school in person a few weeks ago, we asked if going back to virtual learning is something that parents should start preparing for.
Are you keeping track of cases, positive cases in schools? And is there a threshold where you start to advise districts to go back to either a hybrid or an at-home model?
That's a good question. So we've seen an increase in children overall, not only in the country, but also in the community. So we continue to meet with our schools on a weekly basis and provide them advice, as well as provide them with mitigation, additional precaution and testing options, which most of them are actually using testing, so we can identify early. Our goal has been to provide our schools with all of the information, all of the tools, all of the decision points, and all of the support, so they can make decisions real time.
So in the end, each school district will make its own decisions about virtual or in-person learning models. But Dr. Velasquez did emphasize how important it is for kids 12 and up to get vaccinated, because the overwhelming majority of new infections and hospitalizations are those who are not vaccinated. Well, across Washington, we are reporting the highest number of COVID cases and hospitalizations since the start of the pandemic. 1,500 people are hospitalized with COVID right now in our state, which is creating extreme health on the healthcare system.
Yeah, the state also hit a grim milestone yesterday. There have been more than 7,000 COVID deaths in Washington. Earlier this week, the State Hospital Association reported that cases are plateauing, but the number of patients on ventilators has continued to increase. Between February and July of this year, more than 8,000 people who weren't fully vaccinated had to be hospitalized. In comparison, a little more than 500 fully vaccinated people were hospitalized. The Medical Coordination Center has received more than 1,000 requests since July to move patients from small rural hospitals for care. All right, so how many people are hospitalized in Spokane County right now? Let's take a look. According to the Spokane Regional Health District, 236 people are hospitalized right now with the virus. 248 new cases were reported today alone, as well as 4 new deaths. Meantime, in North Idaho, 105 people are hospitalized with the virus right now. That's according to the Panhandle Health District. 277 new cases were reported today alone as well. And what's even more sobering, 17 new deaths were just reported today. Now, I want to make it clear, it is not clear yet if there was a backlog in cases that was just reported today or not. So we're looking to learn more about that one. In the meantime, we know this is a lot of information we just threw at you, and we are committed to keeping you informed about the coronavirus here in our community. So for the very latest information, just check crem.com or text the word COVID to 509-448-2000, and we'll send that link directly to your phone.
Those numbers that you just said,
yeah,
very disheartening.
Right. Let's all be careful, right?
Let's all be careful.
Do our part. Okay, let's take a break from the headlines. We are seeing some pretty big changes in the forecast. We're talking rain, right?
Well, October weather arrives now in September. We had sunshine this morning, actually had a very nice day. Then the cloud cover moved in. You can see it right there. And the wind as well. We've got wind out of the west now, about 16 miles an hour, 67 degrees the current temperature. Look at the cloud cover on the satellite and radar picture, but not seeing much in the way of rainfall. That will all change by the weekend. I do think we're going to see sunshine on Thursday, but we'll stay out of the 70s. Most areas in the inland northwest will only see daytime highs in the 60s. Rain starts Friday night. It pours Friday night into Saturday with a daytime high of 62. Chance of some thunderstorms and rain showers on Sunday. Continued below average temperatures, also a high of 62. I'll check your 10-day forecast coming up in just a few minutes.
Always kind of a bummer to have rain on the weekend, but man, we certainly need it right now, right?
We're down about 5.5 inches from normal, so yeah, let it fall.
Let's start chipping away. Thank you, Tom. Well, a national shortage of school bus drivers has now reached Spokane. Coming up after the break, well, we have learned about why bus drivers are hard to come by right now and how that's impacting our kids.
Plus, later, all eyes are on the sky tonight as the first civilians are headed to space, and on board is a man from right here in the inland Northwest.